Now let's understand how to identify a shallow anterior chamber just with torchlight in a patient. The diagnosis in acute angle closure glaucoma. These patients will have a shallow or a narrow anterior chamber, and how to pick them up with torchlight. Simply throw the light from the temporal end and we can see that the temporal iris will be illuminated but the nasal iris will have a shadow. For example, in this patient, when you're going to throw light from the temporal aspect, you can see that the temporal iris is lit up, but whereas the nasal iris is darker, which indicates a shallow anterior chamber. In a normal patient who's going to have a normal anterior chamber depth, we throw a light from the temporal aspect, both the nasal and the temporal are illuminated equally. It's like sun shining on a flat iris versus sun shining on a bulging iris. So the message is, a normal person with a shallow anterior chamber, always be aware of dilating drops, because dilatation of the eye can trigger an angle closure attack, and that's why we give a constricting drop such as pilocarpine to break this angle closure. Very important.